Welcome to Alberta Rheumatology's discussion on fibromyalgia. Fibromyalgia is a common cause of widespread chronic pain that affects about 5% of the population. It's not considered autoimmune or inflammatory in nature, and unfortunately its cause remains poorly understood, but it's believed to be possibly due to a genetic predisposition and altered pain processing. Women typically get fibromyalgia much more commonly than men, and any age can be affected, although it's most common under the age of 50. The features of fibromyalgia include diffuse head-to-toe pain. This can involve the joints, muscles, bones, or everything, and it can be described as achy, shooting, flu-like, and so on. The trigger is sometimes known, but often not. It's also common to have chronic fatigue. You might feel unrefreshed despite sleeping, and minor activities can cause exhaustion. You may also have a decreased exercise tolerance. Finally, cognitive disturbances may occur, but they're not common in everyone. Additional features associated with fibromyalgia include headaches, paresthesias, which are sensations such as numbness, burning, and crawling, depression or anxiety, irritable bowel syndrome, pelvic pain, and others. The diagnosis of fibromyalgia is typically made by a family physician or a specialist in fibromyalgia. They'll ask you questions about your history and your symptoms and may go through some questionnaires with you. They'll also perform a physical exam. Usually, there are no abnormalities in any blood test, but it's important to rule out other diagnoses such as thyroid disease, lupus, rheumatoid arthritis, and medication-related causes. Fibromyalgia is treatable. There are many strategies that you can use, such as exercise, which helps with pain, function, and sleep. Small amounts of low-impact aerobic activity with gradual increases over time is what's usually recommended. It's better to do 5 minutes than do nothing at all. And it's important to be mindful if you're pushing yourself too hard. It's also important to do what you enjoy, whether that's swimming, running, cycling, and so on. Sleep improvement is another important strategy. This can include things like meditation, having a regular routine, and not exercising too close to bedtime. Other strategies include addressing any mood concerns that may arise. This can include helping you to cope with pain and setting goals for yourself, as well as certain medications. They have limited evidence and their long-term benefits are unclear, but they may be useful to you. Education is another very important strategy. It's important to become familiar with what fibromyalgia is so that your expectations are addressed and that you're wary of sources of information that are out there, as not all of them are backed by evidence. For more information, please visit our website at albertarheumatology.com or discuss further with your doctor.